This call is now being recorded.
Good afternoon to sir and everyone. Myself Harshita Jaiswal. Today I am going to present my research topic. My research topic is effect of Brahmari Pranayam intervention on stress, anxiety, depression and sleep quality among COVID-19 patient in home isolation. The authors of this research paper are Dhanalakshmi Jagdishan, Archana R, Kanan R, Timsi Jain and are as following. This research paper was published in the year of 2022 in the Journal of Ayurveda and Integrative Medicine. The impact factor of this journal is 1.7. So I would like to start my presentation with introduction. This research paper is basically based on the COVID-19 patient in home isolation. The COVID-19 pandemic has profoundly impacted individuals and healthcare system worldwide, and over 40 million reported cases. The surge in symptomatic cases, particularly those with acute respiratory distress syndrome, overwhelmed healthcare facilities, leading many patients with mild symptoms to remain in home isolation or dedicated care centers. Patients in home isolation often experience heightened stress and anxiety due to the lack of direct medical support, which leads to disrupting in their sleep pattern and lowering their quality of life. This study shows that breathing exercise, which the author taken here, the Brahmari Pranayam, can effectively improve quality of life and alleviate mental health challenges like stress, anxiety, and depression. The need of this study is why the author taken this topic. As COVID-19 has rapidly increasing, the most common cause of mortality in COVID-19 has widely been reported to acute respiratory failure. Though many antiviral drugs and respiratory therapies are being used, there are several ongoing clinical trials on alternative medicine for development of new therapies, but till date there is no evidence of any effective or specific treatment for COVID-19. These kind adverse effect of mental stress can be tackled with yoga techniques such as pranayama, which improves vagal tone that is essential to maintain the calm mind. So the present study aimed to assess the effect of Brahmari Pranayam for the patient diagnosed with COVID-19 during home isolation. The followings are the inclusion and exclusion criteria. The author taken these following inclusion and exclusion criteria, which are he taken the patient who were under home care program of the host institute, the patient who met the diagnostic criteria of COVID-19 and asymptomatic, those who are not show the symptom of COVID-19, all adult patient under 18 to 60 age, and lastly who agreed to participate with the mobile communication internet facility and able to cooperate with the doctors in online. The exclusion criteria are as patient who were at moderate to critical stage, who are symptomatic to COVID-19. Patient with already existing acute respiratory disease not caused by COVID-19, asthmatic patient, heart disease, cognitive impairment, and pregnant women. Those who are not willing, they exclude those participants who were not able to follow yoga protocol or not able to cooperate with doctors for the survey or intervention. The methodology, this current study uses the quasi-experimental study, the pre-post design. Quasi-experimental study is a research design that evaluates relationship between an intervention and an outcome without randomly assessing the intervention. So, it's a quasi-experimental study, so there is no control group was taken. The sample size is 40. Sampling method is asymptomatic COVID-19 patient, those who are not symptoms to COVID-19. Why they only take the COVID-19 patient? Because patient in home isolation are reported to have an additional stress and anxiety due to absence of medical care team. And presence of these psychological issues may affect their sleeping pattern and quality of life. And the participants, what 40 they taken, among them 28 were male and 12 were female, and the average age was 39. The source of the sample is COVID-19 home care program of Savita Medical College and Hospital, Thanadalam, India. This is a consort diagram which I have made to represent the whole intervention, which we will talk about later. First, we'll go with the assessment tool, what the author take in this research. All the parameters were assessed using electronic questionnaire using Google Form, because this whole study was done by online platform. The assessment tools were DAS, Depression, Anxiety, Stress Skill 21, to measure the level of depression, anxiety, and stress level and its severity. Second, the Pittsburgh Sleep Quality Index, to measure the sleep quality, that assess sleep quality over a 1 month time interval, and there are 7 components of sleep also. The last one, they have used WHO quality of life to measure the overall quality of life. This questionnaire was developed by WHO to measure the quality of life on the 4 parameters, that is physical, psychological, social, and environmental domain. All these 3 questionnaire was used in using the Google form. Next, intervention. The intervention author was taken the Brahmari Pranayam to reduce the stress, anxiety, and depression. Brahmari Pranayam was demonstrated by qualified yoga and naturopathy physician via Zoom video call. Instructions were also given in their own regional language, that is Tamil. Duration of the study was the 15 consecutive day. The total duration of the whole study was taken in the month of May and June 2021. And the authors personally contacted and to all the participants, and proper instructions were given to them regarding the Zoom. Duration of the practice was 20 minutes twice a day, approx 20 cycles. Timing were 6 a.m. to 7 a.m. in the morning and 6 p.m. to 7 p.m. in the evening. The duration of the practice was 20 minutes twice a day, in which each cycle of practice was done at the rate of 3 to 6 breaths per minute, followed by 2 minutes of rest. Daily attendance and duration of the practice of each participants were noted separately in a logbook. Now we are again going to the consort diagram, where everyone can understand about the study. In the starting, author taken the 60 as eligible participants, but among them 18 were non-willing to participate. So total 42 participants were enrolled in the study. After that, on the day 0, when they did the orientation, at that day they collected the pre-data at the baseline. After that, they started the 15 days intervention of the Brahmari Pranayam. And at the last day, at day 16, they collected the post data collection, among which they only collected 40 samples, 40 participants data, because 2 were dropout due to they didn't complete the assessment. And after, at last, they did the data analysis. Then we come to the data extraction, how the author take the data from the participants. All the patients were instructed to fill the questionnaire at the baseline and after the intervention. The baseline data was collected on the same day using Google Form, guided by the invigilators. The patient practiced pranayama for a duration of 15 days and on day 16 post data was collected. Then the data analysis. For the analysis, the author taken the R statistical software version 4.0.2. All statistical test used a two-sided test with p value less than value 0.05, indicating that the difference is statistically significant. Continuous variable was compared using pair t-test, and categorical data was compared using chi-square test or exact probability method. Normality of data was tested using Kolmogorov-Smirnov test. Cronbach alphas was computed for the internal reliability scores for each scale. Then the results came out after the Brahmari Pranayam intervention. A significant reduction in mean score of depression, anxiety, and stress, and total DAS were found among the patient. A significant decrease in percentage of patient had severe anxiety symptoms, which is p-value is equal to 0.04, were observed after the intervention. Whereas for stress, a significant decrease in percentage of patient who had moderate stress symptom was observed after the intervention, where the p-value is 0.01. A trend of improvement in mean score of quality of life for physical domain, psychological domain, social domain, and environmental domain were found to be statistically significant after the intervention. The sleep quality index also gives reduced significantly with the value 0.03 after the intervention among the patient. So in the chart also we can see this is the comparison of quality of life and sleep before and after intervention. So in this we can clearly see that in the physical, psychological, and social and environmental domain, before they have very less value, after the intervention there is a significant improvement. And in the sleep quality index also, the significant decrease we can see after the intervention. If we talk about the comparison of DAS indicator pre and post intervention, then we can clearly see that in the depression level also, before and after intervention, there is a significant decrease and p-value is less than 0.05 in every aspect, in every level of depression and anxiety. Then there are some limitations of this research paper, that the sample size is very small. They only taken the single center. The evaluation period is also very short and there is a no control group. Some other limitation I found it from my side, that there should be objective of the objective parameters also should be taken for the assessment. They only take the subjective tool for assessment tool. The author gives suggestion for the multi-center clinical trial needed to confirm these results. There are some strength of this study also with the limitations. The first is timely relevance, means this is the first study that examined the effect of pranayama intervention on COVID-19 patient under the home isolation. This is very innovative approach, that it is the first ever study using the breathing exercise online. The findings are also very significant. The accessibility of the intervention is also very feasible, as everyone can participate in this study through the online mode. The tools are validated. The intervention is very safe. No side effects were seen. Holistic impact. It's not only put impact in physical or mental, it also put a positive impact in environmental, psychological, and emotional well-being. As well as there is no interest of conflict in this research. The conclusion of this research paper is the present study show that Brahmari Pranayama intervention is an effective technique to manage the depression, anxiety, and stress during COVID-19. It also helped to improve the quality of sleep and general well-being during the treatment period. It could be used as a complementary and alternative therapy to manage the negative emotions during home isolation in COVID-19. These are some references of the research paper which the author have taken.
Yeah.
Thank you, sir. Thank you, everyone.
Keep presentation on. Keep your presentation on.
Okay, sir.
Nice presentation, Harshita ji.
Thank you, sir.
Many queries. So I will ask questions later. First, I will give opportunity to the students. If anyone you want to ask to Harshita ji, you can come forward and ask to any doubt in this presentation. Yes, Prakash.
So many thanks to madam. Your presentation PPT are very nice actually. My question is, you have not taken the control group. Okay, no problem. Sampling method also very good. But that primary, it is not directly my. This is my opinion. Maybe I am wrong. Before primary, we can also it should be taken the other way. Pram and mantra chanting or stress level to reduce the stress level. But directly you gone to for primary, maybe it is effective already you told. My question is, Why you have not taken control group and significant value you have taken, I think 4%. I am not wrong. 4% it is very, very close to what is called the repeat condition. So how to control, how much time you have taken for this, what is called that, for this project? So this is my question.
Sorry, sir, your voice is breaking. I cannot hear the question completely and clearly.
Okay, madam, maybe I am the outside. My voice is not clear. Okay, after 10 minutes, I can able to talk very clearly.
Okay, next participants, please ask the questions.
Hari Om everyone. May I, sir?
Yes, ma'am, you can.
Okay, Harshita, very good presentation. But here I think the thing is lacking that what is the method used for Brahmari? Is there any mudra used, or before Brahmari, is there any breathing exercise they follow?
No, ma'am.
Please.
Okay, there is no breathing exercise they have followed. There is a very simple technique of the Brahmari pranayam. Sorry, I forget to mention the technique of the Brahmari pranayam in the PPT, but they have used a very simple technique sitting in a very comfortable position by closing their eyes and chanting the ma sound by closing their mouth to generate the vibration in their mind with the closing their ear with the index finger. There is no mudra used.
Okay. So have you mentioned the number of times?
Yes,
Maybe
yes.
yes.
Yes, I have mentioned the number of times. The duration of the practice is 20 minutes twice a day. Means in every single day, they practice 2 times a day for 20 minutes, in which each cycle of 20 cycle they practice. And each cycle of practice was done at the rate of 3 to 6 breath per minute. And after that, they have 2 minutes of rest. And again, starting the second cycle.
Okay. Good. That's.
Thank you, ma'am.
Yes, madam, now I can ask the question. You are able
Yes,
to.
sir. Yeah.
My question was actually, but what are the independent and dependent variable? First, and during the Bharamri, you have taken any asana and other pranayam also?
No, they have only taken the Brahmari pranayam, and the independent variable is the Brahmari pranayam, and the dependent variable is your stress, anxiety, depression, and sleep quality.
Thank you, madam.
Thank you, sir.
I think you should highlight that Brahmali Pranayam, how they did, which asana, I think, Siddhasana or Padmasana or in the sitting position. Exactly, because that asana also may affect on the variables. Is it clearly which asana they did practice?
No, sir, there is no mentioning asana. They sit in a comfortable position in a cross leg.
Okay. Okay. Any other? Yes, Pooja Singh. Yes, madam. Come.
Yes, nice presentation, Harshita. I want
Thank
to
you,
ask
sir.
what is DAS?
What is?
DAS, you have mentioned it.
Yes, yes. DAS is a depression anxiety stress scale to measure the level and severity of depression, anxiety, and stress level. This is a self administered questionnaire. It is a questionnaire which is also available online. It contains 21 items that measure the level and severity, the mild, moderate, or severity of depression, anxiety, and stress. There are so many questions you have to fill accordingly, and after that, there is some method to extract the result.
Thank you.
Thank you, ma'am.
Directly, other participants, you can on your mic, okay? Directly you can.
Harshita ji, can I
Yes.
ask question?
Yeah, sure.
Okay. So, is frequency is needed or not too much mandatory for any treatment? I'm generally asking. I'm a question for a treatment. Is
Yes.
frequency of doses is frequency of doses is important or not?
According to me, the frequency is important because it's a completely systematic study to see the result. It's a research. So if we are doing in a frequency, it shows the importance of the frequency, also validate our result, and the due to the frequency, we can say the level of what level of effect in their mind, how much it put effect. If the frequency is low, maybe the effect which put in their body and mind it's may become low. So the frequency is very important, how many times and how longer you are doing the practice.
Mhm. Okay, thank you so much, Harshita ji. My next question is, in this paper, there are practitioners are practicing 15 days continuously Brahmari pranayam, and if I will do another study with same Brahmari pranayam, but I take intervention with 1 day gap, means first day practitioner practiced Brahmari pranayam, second day gap, third day again practice Brahmari, 1 day gap. Okay.
Yeah, okay.
So there will be definitely there will be gap. There will be
Yes,
change in treatment or change
yes,
in result. Sorry.
yes.
So I want to ask you question. Why did you not select different days or too much time period? Or what's the reason to select only 15 consecutive days?
Okay. Because there is a online method. First, it's a we can say that people are not very uh, sometimes if the research time is very long, so they cannot complete the assessment period of time. So that's why the author take 15 consecutive days to see the result. Maybe the previous researches were done less than I don't know about the previous researches before this, and this is the first ever for the online. So sometimes internet connection, there are many other factors which put impact in the intervention study. So that's why the author take only 1 month the study is total about 1 month, May to June 2021, and during 15 days it's only take the practice.
Okay, but there will be author should mention the reason why he select 15 consecutive days. This is my question. Author should mention.
Yeah, author should, but the author didn't mention the reason why the author take 15 days. But according to me, maybe the on this practice is online, so there may be some barriers to take it so long.
Okay, okay. Is any reason to perform 2 times Brahmari pranayam, two cycles, one in evening maybe or one in morning? So is there any reason to do 2 times Brahmari pranayam in a day?
Maybe the author think that the period of study is 15 days only. So to put the most effect, that's why they put 2 times a day and to maintain the consistency.
Okay, if I want to do the same study, if I want to do 4 times 4 cycles in a day, so what will happen? Is it good or not for my study?
4 cycles in a day you can, but maybe the participants were not available for 4 times in a day. The availability of the participants should also be considered in the study. Otherwise, they cannot complete the assessment 4 times in a day. That's why.
ओके मुझे लगता है कि इसका भी हर एक चीज का एक रीजन हमें देना पड़ेगा व्हाई द ऑथर सेलेक्ट ट्वाइस अ डे द प्रैक्टिसेस
Yeah, sure. You are correct.
The same question, I also have the same question, Harshita ji. See, only 15 days are enough to show the results. It's a question because 15 days are less for a study. I feel so. And second thing, the timing is mentioned in like 1 hour, 6 to 7 in the morning and 6 to 7 in the evening. So, but the duration of the practice Brahmari is only 20 minutes. So why they have kept 6 to 7 1 hour time period?
It didn't mention in the research paper that they practice for 1 hour. It mentioned in the research paper that the participant prefer morning 6 to 7 time. In between 6 to 7, they can practice 20 minutes a day, 20 minutes only. And in the evening also same. Yeah, it's
Okay, so no
not.
other intervention was given to the participants. Only Brahmari were given, but for
Yeah.
20 minutes
Yes.
in this period of time.
Yes, only 20 minutes, 20 cycle per minute per cycle.
Okay.
Yeah.
Harshita ji, what is the validity and reliability of all the questionnaires you have not mentioned in your PPT? But you had mentioned the valid questionnaire in your strength of the study.
Yeah. Because the whatever the assessment tools author taken, the dash, Pittsburgh sleep quality and WHO, these all shows that these all have some components of question. For example, in the dash there are 21 items of questionnaire which is related to the behavioral pattern of the human. And when we put out the I exactly don't know the method or how to how to score the questionnaire. So according to me, when they score, they give the valid and reliable, because these are the tools which is validated by the other researchers also.
Okay,
And that,
Harshita ji, I got your point. But my question is, why are you select those questionnaire? There are too much questionnaire about depression, stress, anxiety. Why are you select only those? And also, you did not mention the validity and reliability of questionnaire. Why should we believe that these questionnaire are good, or we will have to use the same questionnaire in our study? Have you should mention the validity and reliability of questionnaire.
okay.
Am I right, Rahul sir?
Yeah, you are right.
She should know, but I think these are the international standard questionnaires. So all the researchers, they know they are the standards.
Okay.
Yeah, these are the standard and international validated questionnaires. Yeah.
Okay, Harshita. My next question is, what is the difference between subjective or objective tools?
The difference between the subjective and objective tools are subjective tools depends on the individual assessment, and it is maybe more biased, and objective tools are very scientific and clinical. So that's why objective tools are more validated. But here we can say that the author didn't use the objective because of the some barriers, because they have to take the study online because of the COVID.
ओके बट क्वेश्चनर तो ऑब्जेक्टिव होंगे ना क्वेश्चनर में तो
Yeah.
उन्होंने कुछ लिखा नहीं होगा अपने लिए कुछ
Yeah.
उन्होंने उसमें तो ऑब्जेक्टिव क्वेश्चंस ही होंगे, ऑब्जेक्टिव मार्क करना होगा 5 4 3 2 1.
Yes, yes.
So I think it is also an objective questionnaire.
Yeah, but sometime they can maybe sometime they can not honestly filling the questionnaire, because the questionnaire is filling by the participants. Yeah, what they are feeling, maybe they are not confident about the feeling, they are confused about the questions. So that's why this is the difference between the subjective and objective, that the subjective is little biased than objective.
Okay. Well, sir.
Madam, ma'am, questionnaires cannot be objective.
Okay.
So the objective meaning that in research what we see invasive and the non-invasive measurements tools. Okay. So invasive meanings which we are taking any our cells or any muscles. Blood we are taking, these are also part of the cells. So that are we called, they are the invasive methods. And the self-assessments, the questionnaires, all the questionnaires, they are under the self-assessments. So they will under, we will say in the research, they are the non-invasive tools. And all the scales, most of the scales are in the objective manners, but the objective measurements meaning the other things. Objective measurement meaning that, for example, that machines we are taking, that content which we are getting, the results, the machines they are telling us, they are the objective tools. Here in this research, they are using only self-assessments. Self-assessments meaning the participants, they are responding. They may be feel wrong. Maybe by mistake, maybe they don't know what is the exact meaning of the questionnaires. In the hurry, they can feel. That's why self-assessment are not more reliable. Okay. Yeah. Please ask the next question. Yes, Laviji.
Sir, I want to ask one question that I just want to know that the 15 days period is enough for a study, or like why they have taken so much less time
As per my,
for the intervention.
if this synopsis come to me, I will reject. It is not good study at my point of view. And I also notice, Harshita ji, please let me know what is the have it is ethical clearance is there, or any CTRI registration is there of this study?
Yes, sir.
Yes.
It is ethically cleared, and there is a CTI registration also.
You did not highlight in the PPT, why?
Sorry, sir, I didn't know to this highlight also.
It is very, very
Otherwise,
important. Very, very important. CTRI and ICR. Okay. Next questions. Yes, Leviji.
मैम मेरा क्वेश्चन ये है कि आपने ये जो टाइम सेलेक्ट किया है मॉर्निंग 6 to 7 एंड इवनिंग 6 to 7, तो ये क्यों किया है? क्या हम इससे अदर किसी टाइम में नहीं कर सकते हैं?
no, it's not like that. We cannot do at any other time. We can do at a different time also, but this time is chosen preferably by the participants, that they are available at this times only. That's why the
Ma'am,
author
any
taken
other scientific reason to do it in morning?
yeah, there are scientific reason to do in the morning. I don't know the exact, but what can I say? In the morning, our mind is more freshen up, and the environment is also clear. So it's good for the body and mind also to practice in the morning.
Okay, thank you, ma'am.
What is the impact factor?
The impact factor of the general is 1.7.
ये होता क्या है?
Sir, can you, ma'am, can you please explain this? What is this impact factor?
Ma'am, the impact factor shows that how much research is giving the impact on the society, how much it is impactful on the population and in the society. The research is how much reliable and good.
But
What
I
is good value of
is
impact
it,
factor?
is it out of 10, or like how we calculate this? Or how we'll come to know ki this is the figure of the study?
As high the impact factor, as much as it is good. It's not like that out of 10. It may be sometimes 40, 50, and 90, like that. It depends on the generals.
Sir,
Okay.
I didn't get it here.
Yes, Pooja madam, the impact factor, it is standardized by that the journal only, that how many that researchers they are citing the published paper of the journal. So it improves. So as much it is higher, it means the more researchers they are believing, and it is more popular journal in that field. Okay. So and the indexing also, I think she should also mention the indexing also. Please, others also next presentation, please mention here indexing. Indexing meaning that research paper is published in which domain, in PubMed or Scopus, Google Scholar, etc. Okay, of regarding that journal. Okay, it is journal information only. Yes. Yeah, Harshita ji, please show the first one by one. I will ask now questions to you. One by one slide. Okay. Next slide. Next slide. Yeah. At the end, I noticed that you mentioned the reference. It is really nice, but in this PPT, I cannot see which reference it was. So here also you mentioned here that these kinds adverse effects, mental stress can be tackled. It is the statements, but you did not mention the reference. Why?
Sir, because I thought that it's a presentation, so
No,
in research paper it's mentioned always, yeah, in references that
you should
from
also.
this statement.
And then what is the use of the reference at the end? What is the use of that?
Yeah, you are correct. I should mention the references in every slide.
Every slide and every statement. If research paper they mention, then definitely you should mention here.
Okay,
Okay.
sir, sure. Okay,
Okay.
thank you, sir.
Next slide. Yeah. Here the 18 to 60. What are the that because the males also there, females also there. My question is to the participants. They have they suffered from COVID, or they are the COVID did not touch to them.
Sir, they are not suffered from COVID. They are in home isolation. Means so there may be some of their um, home members or family members are suffering from COVID. That's why they are in the home isolation. So they only take non-symptomatic home isolated patient.
What is the criteria they used to diagnose them? Are they really healthy, or they are the patients? Any criteria they used?
Sir, they only take the asymptomatic COVID-19 patients who are in the home isolation in the COVID-19 home care program.
COVID-19, all me and you also. I think we everyone we are at the home.
No, no, sir. The home care program of this medical college, Savita Medical College and Hospital, there are whatever they have in numbers. Among them, they selected who are willing to participate in this study.
They did not mention the exact criteria, which
No,
criteria
sir.
is followed. So it is you should
No, sir.
mention it is a limitation now, but you
Yes,
did
sir.
not. It is the biggest limitation. Who are the participants? Actual participants. Are they working, or they are the from they are doing from home to office work? And you did not know any that clarity, because that also affect the their that results now. No clarity about the participant. They may be college students, they may be housewives, they may be professionals. No clarity about the participants. But you did not mention in the limitation.
Yes, sir.
Okay, go to the back. Hmm. Hmm. Yes, go to the next slide. Next slide. You mentioned the study of the period. It is, I think, June. Please repeat it.
Sir, May to June.
May to, I think, as my experience in May, the lockdown was not there. Even they organized online. Why?
Sir, because for the safety, because we, there is not lockdown, but we need to take proper distance and proper other safety measures so that it's not spread to anyone. That's why they put it online.
And the intervention which is given here, it is regularly given by the instructor, or they were practicing self-practice at home. How?
No, sir. Every day online Zoom meeting, via Zoom meeting, they are practicing with the instructor.
The same question I am highlighting here. 20 minutes you mentioned here, but the hour, it means you are telling 1 hour the meeting open. 20 minutes as per their time schedule they are joining. It is not matching. Please clarify it. Yeah.
Sorry, sir. Please.
If meeting, for example, today our class we started at 12. Okay.
Yeah.
So if the
Yes.
instructor he is teaching to them, then they
Yes.
last time should be fixed. But you are telling that 20 minutes is total, but there is mentioned 1 hour. Please clarify what is it. No time schedule fix here, or they were doing self practice at home without instructor guidance.
No, sir. They are practicing online via Zoom meeting with the instructor, and they are also taking report every day. But the time slot is only 6 to 7, and they didn't mention the detail that at what minute, at what time they started and ended the practice.
Okay.
But there,
And
sir, in the studies, there should be mentioned if we are showing 1 hour time period, so we have to show that what the participants are doing in 1 hour. Or
Yes.
yeah, few maybe
isn't
is more times because if meeting time is 1 hour, so what is the clarity that they did only 20 minutes? They may do 15 minutes and they may do 30 minutes also. It may be possibility. How they control this thing?
yes, sir, correct. It's my question also, sir.
Yes, Harshita ji, any clarity about that? But you did not highlight in limitation. Why? What is the use of presentation? You did not notice these points.
Yes, sir.
Okay. My
Sir,
next
may I say
question.
something?
Yes, Aruna ma'am.
Sir, I think the time slot is 1 hour, but as the teacher availability, they select 20 minutes, as per my knowledge, 20 minutes within this span of time, like 6 to 7, as per my knowledge.
So
I don't know.
you are telling many teachers were there. Teacher,
No, because the practice time is 20 minutes. So, as Harshita said, this time is selected as per the convenience or availability of the population. So, the 20 minutes are selected between this span of time, like 6 to 7 in the morning and 6 to 7 in the evening. That's what I understood, but I don't know.
what happened? What is the challenge in Brahmi Pranayam? Which I also feel during my when I was student, because when do practice this pranayam, we cannot hear any instruction. It is the limitation of this practice. What instructor is telling participants is unable to hear, but he changed something. How he know that 20 things, 20 minutes has done? Okay, how he counted that? Okay, 20 cycles is with this help they can count what 20 cycles has done. It is nice thing. Okay, but the clarity should be more there, but it is not more clear.
Sir, wait.
Yeah.
They mentioned that 20 minutes twice a day. Each cycle practice was done. Means after every one cycle, they take rest for 2 minutes. So if we calculate that 2 minute also, then it completed the 60 minutes, 1 hour.
So you are telling one, then 2 minutes rest, then again,
Yes.
then 2 minutes rest. Eh?
Yes.
Who validated it? And I did not see anyone who practice like this. What is
Sir,
the
it is
logic behind the 2 minute rest? Are they tired with the chanted? Why 2 minute rest? It is too much. 2 minutes are really too much. They will get sleep. Why?
Yes. Don't know, sir.
So that kind of clarity should be there. Okay, these things the what is the reason of this presentation? So you are able to know the mistakes of the research papers. It is the my reason that you all present and you will get these are the mistakes. If you are able to find mistakes in this study, then that things you will take care in your study, na? Okay.
Yes, sir.
Next slide. Yeah, just here, just wait. Go back. So, same slide, madam, same slide. Come back again. Yeah, here you are mentioning daily attendance and routine. Duration of the practice of each participant. Okay, yes, duration is noted here. Good thing. Daily attendance is there, but they did not highlight that how much, what is the criteria of the attendance, because I am sure that that all 100% attendance not be there, something dropouts there. How they diagnose them and which criteria they followed? 80% attendance, 90% attendance, you did not mention. Why?
Sir, this will be also the limitation of this study.
Yeah, it may possible now. One participants
Yeah.
he only 10 days, and they are including his criteria, his measurement also. But 10 days and 15 days, the result will be different.
Yes, sir. Can possible.
Okay. Next slide. So they should mention the attendance, how the percentage should be there. Okay. Uh, Day 16, yeah. And do you know what are the limitations of the self-assessments? Can you please explain again? Because it is really big challenge. What are the limitations of the self-assessments, madam?
Sir, first of all, that maybe sometimes they didn't understand the questions, what the question mean, how we, and sometimes they don't uh, get the proper answer, like what they are actually feeling. They are not confident about the feeling and about their result. So that's why the questionnaires have some limits and some biasness also.
So same question here, everything is occurring in online. And I am sure many things, if I read the desk questionnaire, so one or two questions to understand is really so difficult.
Yes, sir.
They resolve that problem. Is there any therapist there who were on that live meeting? Yes, participants, if you are getting any doubt, that please ask me, and not please don't feel the wrong answers. Is anything there?
No, sir, there is not like thing. They fill the form, they fill the questionnaire through the Google form.
So it is also the one of the limitations, because the psychological questionnaires, the psychological or that particular expert should be there who can better way explain the exact meaning of the questions if the participants they are unable to understand.
Yes, sir.
Okay, next slide. Okay, I am yeah, it is a test regarding. You told only single group they are taking now.
Yes, sir. No control group there is.
It is also the major really. That's why I'm not liking this study. Only because single group, how can we say that these results are reliable?
Yes, sir. That's
Yes, sir.
also
There should be comparison should be there between the control group and the pre-test. They have taken the pre-test, not some control group should be there, and experience group also should be there, madam, sir.
Yes, yeah. It is the biggest
that.
limitation of this study.
Yes, sir.
And they have
That
taken the
limitation I
questionnaire,
also.
and there should be PCS 10. Questionnaire should be 4 options should be there, and participant must be know what we have to give the answer. Because same thing I have done stress management off mode. I have taken first taken the counseling of the parents as well as the student. Then I just distributed the PCS 10. This is the what is called the American tools, and they have given. I have taken pre-test one, pre-test two, and final post-test. So result was in somehow it is very correct way. So I think questionnaire method also tools should be very accurate. Then result will come. Result will be okay, sir. This is my one doubt is there.
The main thing you mentioned, the orientation. Can you please explain what occurred, what happened in that orientation program, and how long it was?
Sir, in orientation program at the day 0, they just tell them the importance of yoga and how the practice should be done regarding the Zoom meeting on the platform by the yoga physician. They make them understand about the practice, about the importance to the yoga physician. And there is no time. They have mentioned how much long it is, orientation program.
The participants non-yoga background, is there anything there?
Yes, sir. They are of non yoga background because they didn't mention that they are belongs to yoga background.
Because it is online and non-yoga participants, yeah, it is really challenging to make them correct.
Yes, sir.
So it is online limitation. Okay, next.
Yes, sir.
Okay, next slide. Can you explain what is the meaning of 0.04, 0.01? What do you understand by it?
Sir, it is a p-value after measuring the questionnaire score. They after the analysis they bring out some values which is the p-value, and for the significance of the result it should be less than 0.05. So if the p-value is less than 0.05 means the result is significant.
Okay, just to your understanding, I want to know what is 8.90 bracket and what is 5.83. What do you understand what it is?
So it's a mean value.
No. Mean is 38.98. What is 8.9?
I didn't read it about, sir.
I'm
Sorry.
asking to the other participants, what is 8.9? What is 5.83? What is 7.76? And why in every table you see like this? Yes, madam. What it is?
Sir, is it standard deviation?
Yes.
Yes,
Very nice.
100% correct.
Very good. So note it down, Hasita. It is standard deviation. Okay. Very good.
Okay.
Okay. Next slide. So DAS score is down. Depression level is normal. Okay, next. Small sample size. Yes, small sample size, but you did not highlight how they calculated the sample size.
Yes, sir. I didn't mention that. I forget it. Means I didn't notice that there is no method of sampling.
Yes, okay. It is also one limitation.
Okay,
And
sir.
which center they particular practice? Anything clarity about that yoga hall? Oh, sorry. It was home practice, na? Okay. It was home
Yes,
practice.
sir. Online. But they selected the participant only from one center, that is Home Care Savita College. That is also the limitation.
Hmm. Okay, next slide. Timely, innovative, strength. Okay, what do you understand the overall? If I ask to Harshita, what do you, which good things you noticed in this study, and what which kinds of things, if the same study you apply, and which kinds of change you do in your research? Please explain. Yeah.
Sir, if the main if I do the research, then I will make sure that it first of all it should be not online. It should be in face to face offline, and I will make sure the whatever the limitations was there, the demographic calculation of the participants, they are what are their backgrounds, and how I am taking the sample. The sampling method should be very clear in that phase. And I will use some objective tools also because for the validation of the result.
Okay. Any other?
Sir, also the time clarity that the author can mention the duration of the time, what in the 1 hour, not clear, but not very clear, like 1 minute practice and 2 minute rest. It should be not there in my study. I will make sure.
Okay, nice answered, Harshita ji. Yeah, any other have any doubt? You can ask. Then we will close the presentation.
Sir, I want to learn about some this statistics part. Can you please explain?
Statistical part, ma'am, because it depends on the first of all the according to data we can understand it is only which kinds of data we are getting. First of all, first we will decide how many groups we are taking. It will decide that independent test we should take or the paired sample test we should take. Or more groups than ANOVA, it's extra that kinds of test we should select. And after that, and the other things also, before collecting the data, we cannot assume that this particular test we will use. We cannot 100% make sure this test we will use because it may happen. It depends on the structure of the data. It is normally distributed and the not normally distributed. According to it, that the exact test will be decided. So we can just assume, but we cannot make sure that 100% I will use this test. It is the wrong approach in research. Okay.
Okay, sir.
Okay, nice presentation, Hasita ji. Very good. And I am also expecting to other participants also, you will also give best as like Hasita did without laptop. Just she prepared everything through her phone. It is also really nice thing, which a really impressive thing. Without laptop, Hasita prepared very well PPT. Very good, Hasita. Nice efforts. Yeah.
Thank you, sir.
Next Sunday, who is presenting?
Sir, I want to present one study, but can I present next to next Sunday?
Okay, first you have to be